There certainly are many medicines and medical treatments that are a little controversial, probably none more so than medical marijuana.
THC, a key component of marijuana, is an FDA-approved treatment for several conditions such as pain or seizures. And some patients say it's the only thing that works for their symptoms or condition. Medical marijuana is prescribed to treat muscle spasms caused by multiple sclerosis, nausea from chemotherapy, poor appetite and weight loss associated with chronic conditions like HIV and nerve pain. It can also help those with diseases like Crohn's disease or glaucoma. Now, medical marijuana is currently legal in 23 states and the District of Columbia. Those who live in one of those states can get a medical marijuana card if a doctor thinks it can help their symptoms.
But what happens if you don't live in one of those states? Many people are at the mercy of their state's lawmakers as more and more are considering medical marijuana bills, which can prevent some people from getting the medicine they believe they need.
That's migraine medication.
8 pills a day.
That is for my hip.
Twice a day.
This is for my moods, but it also helps with pain.
This is the life of 46-year-old Angela Doak. In 2002, the mother of 4 was diagnosed with MS.
I can't talk right anymore.
Angela believes medical marijuana, if legalized, would give her some quality of life back.
Not being able to talk, not being able to walk, so that has just been this year.
She believes she could reduce her medication in half if she could use medical marijuana.
I'm on like 4 different medicines for pain. Gone. They'd be gone.
She knows her disease is getting worse.
I don't want to die.
For people like Angela, whose life revolves around a pill box, she says life would be different with medical marijuana.
I take medicines first thing in the morning. I take medicines before I go to bed at night. I am constantly tired. I wouldn't be anymore.
As far as Delmarva is concerned, medical marijuana is legal in Maryland and Delaware.
But in Virginia, its legality is extremely limited.
Delaware first passed medical marijuana legislation in 2011, but there have been some hiccups in its rollout. Again, patients must have one of several approved conditions. They must get their medicine at a state dispensary. The first opened earlier this year in Wilmington. Also this year, Riley's Law passed, allowing children who suffer from epilepsy or dystonia to be prescribed cannabis oil.
Maryland passed its medical marijuana bill in 2014. Under the law, patients will be able to have up to a 30-day supply of the medicine if they have certain approved conditions. Right now, there are no dispensaries in Maryland.
But applications are being reviewed for a medical marijuana growing license. The state will choose 15 companies.
But you can't talk about these locations without bringing up how secure they'll be. Joining us today to tell us more is WBOC's Lindsay Tuckman. Thanks for joining us this afternoon. As we mentioned, there are several applications up for review in Maryland, and some of them are here on Delmarva.
Yeah, that's right. More than 800 applications actually were sent into the state to be approved to be either a grower or a seller. And that's the whole state of Maryland, but of course there are some in Somerset County and in Wycomico County.
Now, I can already hear people saying, you know, not in my neighborhood.
Right, exactly. Some people are worried that they'll have a marijuana facility opening up in Wycomico County, and people will go in, buy that cannabis, and then sell it to kids in the neighborhood or people, and then it'll become an illegal problem. So people are concerned about that if it does get approved.
So bringing it in legally and then people turning around and selling it illegally.
Exactly.
All right. Okay. So that's why the Maryland Medical Cannabis Commission is taking a close look at these applications when it comes to security.
Right. They have lots of requirements when it comes to opening facilities, and some include full intrusion alarm systems or video surveillance. So there's one company actually in Fruitland called Centec Security, and it's a man, Justin Center, a local man, who is helping these companies that are reaching out to him to develop their security procedures.
So are they concerned about, you know, everybody going in and out of these dispensaries, or is it just certain people?
Right, you'd think that there'd be people who are buying it could be a problem, but there's also contractors that go in, security officials or employees that they have to look out for.
With such a product that's in high demand, they not only have to worry about people from the outside coming in, they're going to have to worry about employee theft and contractors, anybody that enters that facility.
And many of these companies are going all out when it comes to security. What are they doing?
Yeah, there are a lot of other things they're doing, but you'll have to watch tonight to see what that is.
Lindsay, thank you so much. We're looking forward to seeing your story, Dispensaries on Delmarva, tonight on WBOC News at 10 on Fox 21.
And tomorrow we're digging even deeper into this topic. WBOC's Chris Weimer drops in to tell us more about the Maryland Medical Cannabis Commission, the group that will review the applications we just discussed. Wait till you hear how competitive and thorough this whole process is.
Well, many people across the country advocate for legalization of marijuana because they say it is a beneficial medicine. But what about those on the other side?
Opponents say it's still a harmful drug, and making it more readily available, whether for medical purposes or outright legalization, is dangerous. In fact, a study on Colorado's marijuana legalization found significant increases in marijuana-related traffic deaths, hospital visits, and school suspensions. One Colorado father learned about the drug's dangers the hard way. He found his 13-year-old son unconscious and not breathing from what he says was a marijuana overdose. He resuscitated his son and later learned the disturbing truth about marijuana use at his son's school.
I'd heard from kids that there was 60% of this particular high school using drugs, and she shook her head and said, that's way low.
A study by the Rocky Mountain High Intensity Drug Trafficking Area says 11% of Colorado's 12 to 17-year-olds use pot, 56% higher than the national average. Now, some say the commercialization of marijuana is to blame.
Marijuana might have been legalized in our state. It did not have to mean massive commercialization and promotion of marijuana use.
That study was about marijuana use in Colorado, where it is legal both medically and recreationally.
Now, there have been attempts to legalize marijuana on Delmarva, but so far those attempts have not succeeded. However, pot is decriminalized in both Maryland and Delaware.
Well, here's something we can probably all agree on: napping. Doesn't that sound nice right about now? Up next, we dig into new research that tells us why we should sneak in some shut-eye.
But don't get too comfy. You don't want to be late for a very important date. We'll also get some pointers on how to be more punctual.
Well, maybe you're late for work because you're procrastinating as long as you can. Find out how to tell if you're dealing with work burnout. DelmarvaLife, we'll be right back.